Amish, John Farrow has been very good about the poker game of the different European countries. Let's triangulate his one example, the United Kingdom, Germany, and Spain. Are we naive in the United States that we're not triangulating New York, Kansas, and Idaho?
Well, I think the country's on different types of timescales when it comes to vaccination. But overall, I think that the country is looking better as a whole than many of the EU countries will do, where you've kind of got a hodgepodge of policies, a hodgepodge of vaccination rollout. So, for example, the UK is in a much better place than much of most mainland Europe. And I think you're going to see that distinction be present until a significant proportion of those populations are vaccinated, where you'll see different policies. And I think they also have different ways of thinking about the virus. And I think that the UK and the US in general have really been countries that have focused a lot on flattening the curve, preserving hospital capacity, and then sort of realizing that this is not a virus that's going to go away, where there are some European countries, as well as places like Australia and New Zealand, that have kind of a fantastical notion of COVID-0, which is not going to occur.
Dr. Adalja, the one common theme is to keep vaccinating people. In your head, what is the number of vaccinations per day for the U.S. to create momentum? Is it 500,000? Is it 800,000? Or do we need to sustain above 1 million units a day?
So I don't look at it in terms of doses per day. I did early on because that was more a function of how well our vaccine rollout was reaching the people that wanted to be vaccinated. And what we did is we used a prioritization scheme. Not everybody was the same priority to get the vaccine, and we gave a lot of those vaccines early on to high-risk individuals, nursing home residents, high-risk community dwelling people, in order to flatten the curve, in order to preserve hospital capacity. And that group of the population is very heavily vaccinated. If you look at people above the age of 65, it's about 3/4 of them are fully vaccinated. So that removed the ability of the virus to cause serious disease, hospitalization, and death. So now what we're dealing with kind of is what I would say a mop-up, trying to get community transmission down. But we're out of a position where this is a public health emergency in terms of threatening hospitals again. So I think as long as we continue to vaccinate as much as possible, that's great. But I think we've already achieved the first goal of the vaccine, which was to tame this virus.
Doctor, as you just said, this is no longer a public health emergency. Any reason to believe it could become one in the future?
In the United States, I think it would be very difficult to see this virus be able to spiral out of control and threaten hospitals again, because the virus doesn't treat people equally, and we have vaccinated really aggressively in those groups of people that constituted the majority of people who were being hospitalized. So to me, I think we've removed that ability from the virus. We've made it much more like other respiratory viruses that we deal with year in and year out. The more we get vaccine into people, the better it's going to be. But I think we really all can breathe a sigh of relief because our high-risk populations are protected.
If the variant that was first identified in India became the dominant strain here in the United States, Doctor, would you be able to say the same thing with confidence?
I do think that when you look at the vaccines, especially the mRNA vaccines, they seem effective when it comes to this Indian variant. So I think the solution to the Indian variant, the way to make your country resilient to the Indian variant, is to get as much vaccine into people's arms as possible. So I don't think any of these variants can pose that problem to the U.S. because of our vaccination strategy. If you're a country that hasn't been heavily vaccinated, these variants can be disastrous. But if you've gotten vaccine into the arms of the most vulnerable, then those variants are going to have a very difficult time putting people into the hospital. They may be able to infect, they may be able to move through your community, but they're not going to crush a hospital.
Dr. Adalja, it seems like there is a disagreement emerging within the public health community about whether this is a public health emergency still, whether we've emerged in a post-pandemic era. What are the scientific underpinnings of that disagreement? In other words, is there some threshold that people are looking at where the cases will go down dramatically and that people disagree on that?
It's hard because each person kind of looks at this pandemic differently. And I've always said that I look at it from a hospital capacity angle, but other people look at it at a case level. And I think that's the wrong way to look at it, because this virus isn't something that can be eliminated or eradicated. Our goal was to be able to tame it and defang it. And if you look at the number of cases, I think there were about 25,000 cases yesterday. We're getting to the point where we're on the average of getting closer to seasonal flu or a bad seasonal flu. So to me, I think that kind of dampens the public health emergency. We've got enough vaccine into vulnerable populations. We have vaccine that's plentiful. We're still trying to reach more people. We're not worried about personal protective equipment, supplies, ventilators, ICU beds anymore. We've got a pediatric indication. So I think all of that has kind of changed the way we have to think about this virus. And Now we have to ask ourselves, would we do this for a bad flu season? And if we wouldn't do it for there, I think that's kind of how we would gauge where we are now in the U.S. with COVID-19. Of course, it's a very different story just outside the country, even in northern, just north of ourselves in Canada. But it's still something that I think we have to really recalibrate and change people's risk perception about this virus, because we've done such a good job at getting vaccine into people who really needed it.